right, it's time. Dermatologist Dr. Dermatology is here to answer your skin questions. Let's get right to it, shall we?
Sure.
All right, first question. I have this birthmark on my face since childhood. I'm embarrassed and would like to lighten it. I've tried creams, but they don't work. Sam from San Diego wants to know, how can you help me?
Let's take a look at Sam's photo.
Okay.
You can see he's got this kind of mottled pigmentation on his temple and down towards his eye.
Yeah.
The medical condition for this is called nevus avota. But the good news is that we have some new lasers that are really excellent at removing these birthmarks. You know, a lot of patients walk around with these birthmarks. They don't think they can be treated. Here's a before and after of a patient that I treated that had actually a much worse, darker birthmark. And you can see after treatment, her skin's still a little pink, but all the pigmentation is gone. So she was really pleased.
Wow, that's a significant difference, one to the other.
Life-changing for some patients.
All right, next question. I'm Chinese and have darker skin, so I've always been told I can't have laser treatment. I want to get rid of those brown spots. Can I? Kim from Mira Mesa. I'm sensing a theme here with these spots on folks. Let's go ahead and look at the picture.
Yeah, it's summertime, so everyone's getting spots or noticing their spots are getting darker. Now, in darker skin patients, like we take this, if you look at the Asian population, the Hispanic population, a lot of them think because they have more olive skin that they can't be treated with lasers, but we have a lot of lasers that are safe to use in darker skin. As you can see here, this patient, this was just one treatment I did on her. She's Chinese, and you can see that she has a really nice improvement. Most of the brown spots are gone with just one treatment, so it's absolutely safe to treat.
Gotcha. All right, next question. I was hiking in Palomar Mountain about 3 weeks ago, and I got a terrible case of poison oak. Ouch. It's completely cleared, and then it came back again. I haven't been out in the woods. How could this be? Joel from UTC wants to know.
So, Erica, you're like our dermatology helper. So why do you think it would come back?
I think it must have been on his clothes or something.
See, you're so good.
I'm so smart. Look at me. Look at the big brain.
That's why you got the honorary dermatology degree.
You're right.
You're absolutely right. They probably still have oil from the plant on their clothing or their shoes. And if you touch that oil and then touch your skin, it all comes back again. So you have to wash everything in hot soapy water.
Everything that you were wearing at the time.
Yeah, and any tools you're using. If you were gardening or something.
Oh,
yeah.
good call.
Backpacks, whatever it might be.
Yeah. A weed eater or something. Interesting.
Right.
Okay, next question. I am in my mid-40s. I have loose and creepy skin on my upper and lower eyelids. I don't want surgery. Are there any good options?
Let's take a look.
Let's look at the loose and creepy skin. That's not that loose and creepy.
No, but you can see her upper eyelid's kind of heavy sitting on her lashes, and you actually want the lid to be higher than that to look, I mean, obviously more youthful. So I have a new procedure that I'm doing where I use 2 lasers, and you can get some really nice, like, look at the difference in her upper and lower eyelid. You can see how it tightened that upper lid and the lower lid and smoothed all the wrinkles. The nice thing about this is there's no cutting, there's no stitches, no scars, this nice, tight, smooth skin.
How do you do that with no cutting?
I use a combination of what's called a CO2 laser and erbium laser, and they're able to tighten the skin up, and you can see the lines are essentially gone. Now, the only thing you have to take into consideration is there will be swelling and healing, which takes about 5 to 7 days. But it's still less than a surgical procedure as far as downtime.
Gotcha.
Yeah.
Keep that in mind. Okay, next question. I'm a mom, and I'm concerned with my son's acne. I've used many topical prescriptions with no improvement. Please help. Tracy from Chula Vista. Let's take a look at the acne, see what we're working with right here. All right.
Interesting. This doesn't necessarily look like acne, but this is the time of year. It's summertime, okay?
There we go.
A lot of kids, there's acne for sure. So this is a patient that I did what's called photodynamic therapy on. Now, she was going back to school, and she wanted her skin to be clear, and she's like, Dr. Groff, what's the quickest way to get my skin looking good? Well, it's called photodynamic therapy. This is one treatment I did on her, and this is the perfect time of year because everyone's getting ready to go back to college, high school. If their kids have really bad acne, it can be really embarrassing and hard for these kids. So that's a procedure we can do to get their skin looking good really quickly.
And do you have to keep doing it over and over again when if acne
That's
comes back?
possible, but a lot of patients want treatment and it'll stay in remission for a year or longer. But there are patients that we have to do a second, even third time sometimes.
Gotcha.
Yeah.
Dr. Groff, thank you as always.
Okay.
We appreciate it. To get in touch with a good doctor, info's on your screen. We've also linked it to our website, fox5sandiego.com.